find the cause. And I think that maybe it's redundant or unnecessary to say this, but once you find, if there is an underlying disease, if you treat that disease, you would hope that the fatigue is going to improve with it. So, for example, if someone is anemic and they get transfused and they're no longer anemic, their fatigue should improve with that. Or if they have heart disease and you treat their heart disease, if someone has the need for a valve replacement and you replace that valve, then that fatigue would improve once the surgical procedure is complete and the patient is recovered. In patients with fibromyalgia that Dr. Abercrack was talking about, often one of the best ways to treat fatigue is through exercise, which seems kind of backwards, but is really by far the one of the most effective ways to treat fatigue without any obvious underlying medical cause. Again, that seems a little bit counterintuitive, but is often very much the case. I'm going to quickly look at these questions and okay. I've already seen two cards here that have asked about polymyalgia rheumatica, which is a question I'm going to defer over to Dr. Abercrack. There's a microphone on the table here. If you could maybe address what polymyalgia is, and maybe if you could differentiate that from fibromyalgia, that could, I see two questions here about that.
I meant to talk about polymyalgia briefly because it's probably the second most common condition we see in this area.